To health matter now, Nigeria's infectious disease experts are raising new concerns over the country's ability to confront both long-standing and emerging health threats. The issues took center stage at the annual general meeting and scientific conference of the Nigerian Infectious Diseases Society in Kaduna State. Lupe Assam was there.
Nigeria's Infectious Disease Society says the fight against infectious diseases requires renewed urgency and stronger coordination. At this year's conference, themed Resilient Health Systems in a Changing World, participants discussed ways to expand awareness, build capacity and strengthen collaborations among professionals working to prevent and control infectious diseases.
This conference was convened this year to address the current issues that challenge the prevention and control of infectious diseases in Nigeria. You all know that in the most parts of the developing world that infections are the biggest burden as far as health is concerned. One of the themes for this year is that we'll be looking at issues around financing and resources for health service delivery.
Some of the key outcomes of this discussion is that there's need to invest in health security, especially in the health workforce, building their capacity to be able to preempt, to be prepared for emerging and re-emerging infectious disease. We require laboratories that will be able to assist the clinicians in their duty for prompt early diagnosis of infectious diseases.
Special guests at the event include the Minister of Health, Kaduna State Commissioner for Health, and the representative of the Emir of Zazzau. A key message from the forum was that innovation alone is not enough. While tools and treatments are becoming available, experts warn that access, affordability, and equity remains a major gap for many low to middle income countries, including Nigeria.
So there are several infectious diseases that are of concern to public health concern to Nigeria, and many of them are emerging and re-emerging. For instance, Lassa fever is a recurrent threat to the country, and we have Lassa fever outbreaks on a yearly basis with attendant morbidity and mortality.
Other issues raised were the need to advance HIV care through long-acting antiretroviral agents with a focus on innovation, access and equity in low and middle income countries. Driving vaccine innovation and self-reliance to tackle endemic diseases through indigenous research, development and manufacturing, and addressing the role of climate change in the re-emergence of infectious diseases in Nigeria. Beyond the discussions, organizers highlighted the outcomes of the meeting, saying the recommendations will shape future policy and strengthen early detection. Lupe Assam, TVC News, Kaduna.